Asthma is a chronic lung disease caused by the tightening and inflammation of airways. When patients have symptoms of asthma, they usually come and go periodically. But when those symptoms are active, it is called an asthma exacerbation or an asthma attack. Symptoms include coughing, wheezing, shortness of breath, difficulty breathing, and chest tightness. When asthma is not managed properly, it can lead to a very poor quality of life and even death. Over the next several minutes, I'm going to give a general overview of asthma, including the symptoms, trigger, the treatment, and when to call 911. When we breathe, our air comes in through our trachea or windpipe. That trachea then divides into a right bronchus and a left bronchus. These bronchi then further divide into multiple bronchi and bronchioles, which end up in air sacs called alveoli. These bronchi and bronchioles are our air tubes. When a patient has asthma, instead of the air moving through a nice, wide, open airway, the airways are tightened. Those smooth muscles constrict. And there's also an increased mucus production in the airways. So what does that mean? That means that patients who are having asthma exacerbations are trying to breathe air in and out of tiny, narrow tubes, which is very difficult to do. When air tries to force its way out of that narrow tube, it often makes a whistling sound or a wheeze. So what are the symptoms of asthma? Symptoms include wheezing, coughing, chest tightness, chest pain. And with the coughing, particularly in children, sometimes they'll have a cough even if they don't have a wheeze. So if you notice your child has to stop to cough when they have exertion or they're running and playing, that coughing could be a sign of asthma. Other symptoms, more severe symptoms, occur when patients are really having a tough time breathing. If you look at a person with asthma and they start to have a flaring of the nostrils, or if you see them using their accessory muscles, meaning they're using their neck, their collarbones are going up and down while they try to breathe. If you look at their abdomens and you see that their abdomens, their bellies are moving in and out while their chest expands, this is a sign of respiratory distress. And this is the time that you need to contact your physician immediately or even call 911. It is very important to be aware of the symptoms of asthma. What are some triggers for asthma? What causes asthma symptoms? Well, definitely cigarette smoke can do it, pollen, pollution, both indoor and outdoor, dust can do it, pet dander can do it, fragrances can trigger asthma attacks. If you look at my YouTube video on seasonal allergies, you'll see where I talk about allergens, things in this beautiful outside nature. They can trigger asthma as well. Guess what else is a trigger for asthma? Stress. Cold air can also trigger asthma. That cold air, once it's breathed in, can cause the smooth muscles in the air tubes to tighten or narrow. There's also an exercise-induced asthma. Now, this does not mean that you cannot exercise. It just means that if you have exercise-induced asthma, you have to take certain precautions. How is asthma diagnosed? In order to be diagnosed with asthma, you must consult your physician. So if you or your child is having some of the symptoms, such as coughing, wheezing, shortness of breath, if some of those triggers are causing you to have symptoms, then you may have asthma. If you have nighttime coughing or nighttime symptoms, you can have asthma. It's important to see your physician where you get a complete history and physical and certain tests like chest x-rays or spirometry. While there is no cure for asthma, we do have management and treatments for asthma. If you are having an acute asthma attack, you should use a short-acting bronchodilator, meaning it makes those airways wider and easier for you to breathe. Albuterol, for example, is a beta agonist, so you should use your albuterol inhaler or albuterol nebulizer. In addition, your doctor may prescribe corticosteroids to help in an acute asthma exacerbation. Now, for long-term chronic asthma treatment, there are long-acting beta agonists, corticosteroids as well. There are anticholinergics. There are leukotriene inhibitors. Again, it's important that you consult your physician so that you can be properly managed. Now, many of you are probably watching this and you're thinking, oh yeah, I have asthma and I just use my albuterol inhaler whenever I need it. But is that albuterol inhaler enough? If you are requiring your albuterol inhaler more than twice a week, your asthma is not under control and you need to see your physician for management. If your child is requiring albuterol more than twice a week, or if they're having frequent nighttime symptoms, nighttime coughing, then your child is not well controlled either. Remember, 4,000 Americans die from asthma each year. 11 Americans die every single day from asthma. Make sure you're not at risk. Most of those deaths are preventable with proper medications and treatment. How do you know when it's time to call 911 for asthma? Well, if you are having an asthma attack or your child is having an asthma attack and you've used the albuterol inhaler, you've used the albuterol nebulizers, but you're still having those symptoms, the wheezing, the coughing, the shortness of breath, and you're showing signs of respiratory distress, especially if you're struggling to breathe, your child is struggling to breathe with the abdomen going in and out, the neck muscles being used, the nostrils flaring, and especially if there's signs of cyanosis, meaning there's a blue or dark tinge around the lips, then it is definitely time to contact your physician immediately and to activate the emergency medical system. Call 911. People die from asthma. Don't be a statistic.